Hello everyone, Dr. Fink here. Today we'll talk about prostate health and testosterone. Quick disclaimer, this is not medical advice, this is entertainment only. So, a lot of you might have heard that testosterone increases the risk of prostate cancer, etc. And in this video, we'll try to break down what is happening in the prostate when we take testosterone. So, let's locate our prostate. So, we are wrapping our urethra where the urine flows down with our prostate. And when the prostate grows, then this puts pressure against the urethra and it can lead to frequent urination. So why does the prostate grow when we take testosterone? There are androgen receptors in the prostate. Testosterone is an androgen. So what happens is, so this is a close-up of the prostate cell. Testosterone enters the prostate cell. Inside of the prostate cell, it can convert to DHT or dihydrotestosterone. And this happens with a molecule, an enzyme called 5-alpha reductase, converting testosterone into DHT. DHT is also an androgen, and is DHT and androgen will bind to the androgen receptor with a stronger affinity than testosterone. So DHT binds the androgen receptor, and this complex will now travel inside of the nucleus of the cell. In the nucleus of the cell, we have our genetic information. And this complex with the DHT and the androgen receptor will now alter the transcription of this genetic information and can cause increased growth of the prostate. So, of course, we need a certain amount of DHT androgens in order for our prostate to function. But if we are taking testosterone from the outside in excess amounts and we have excess amount of DHT, well, then we have excess signaling of growth in our prostate, and this can make our prostate grow. So how can we measure this prostate growth? Of course, there's imaging and ultimately biopsy to see if the hypertrophied prostate is cancerous or not. But a simple test is called PSA, or prostate specific antigen, which you can detect in the blood. And this number should be below 4 nanograms per milliliter. If you're below 4 nanograms per milliliter, usually the healthcare provider might say, okay, your prostate seems fine, there's no need for testing. And if it's above that, you might require some MRI or some biopsy in severe cases. However, having a PSA below 4 does not mean that you are 100% protected against prostate cancer. And having a PSA above 4 also does not mean that for 100% guarantee you have prostate cancer. Okay, so keep that in mind. The PSA is just an indicator of the prostate health, of how much it is growing or not. Okay, to detect cancer, imaging and biopsy are most likely necessary. So now, interestingly, there was a study that compared a group that was taking the 5-alpha reductase inhibitors. So we are inhibiting the transformation of testosterone into DHT, which makes our testosterone higher and our DHT lower. And they looked at the mortality of these two groups, one taking the 5-alpha reductase inhibitor, so increasing testosterone and reducing DHT, and the other group with placebo, so just keeping the same. If you block the conversion of testosterone to DHT, you will decrease your PSA and most likely the growth of the prostate, which sounds good on paper. Okay, so if we block the conversion of testosterone to DHT, we decrease PSA and the prostate will not grow as much. However, they showed that both group had the same mortality rates from prostate cancer after a certain amount of time, which means that even though the one group decreased the PSA number, it did not completely protect them from prostate cancer. Okay, so keep that in mind. I will link the study down below. Another study looked at the potential to put on muscle with and without a 5-alpha reductase inhibitor. Okay, and I think they used Dutasteride in this specific case. So Dutasteride and Finasteride are two drugs usually prescribed for hair loss or acne, and these two drugs specifically block the 5-alpha reductase enzyme, Dutasteride being a little more potent than Finasteride. And since bodybuilders also sometimes have excess or even testosterone replacement therapy patients, depending on how active your 5-alpha reductase enzyme activity is, can experience hair loss and acne. And those individuals sometimes take finasteride or dutasteride to prevent the side effects from DHT being hair loss or acne. However, some people think that if they're taking a 5-alpha reductase inhibitor such as finasteride or dutasteride, it will block the ability to build muscle because DHT is decreasing. So the study I was talking about looked at two groups, one taking testosterone with dutasteride, so blocking testosterone conversion to DHT, and one taking a placebo and not blocking the conversion of testosterone to DHT. I think it was for a couple of months, and depending on the dosage of testosterone, there were several dosages from 50 milligrams to 600 milligrams. The higher the dosage, the more muscle mass they put on. I think it ranged from 0.6 kilograms to 8 point something kilograms for in a couple of months, which is pretty amazing. However, there was no difference in the two groups. No matter if you took dutasteride and you blocked the 5-alpha reductase enzyme, or if you didn't block it, the amount of muscle they put on was statistically similar. Okay, so it didn't mean that if you block 5-alpha reductase inhibitors that you will put less muscle. Okay, so from that study, the take-home message is if you're experiencing hair loss or acne on testosterone, it is not most likely not going to impair your results if you take low dosage dutasteride. In the study I mentioned, I believe it was 2.5 milligrams per day. All right, so don't worry about it. If you want to maximize your muscle gains and minimize your side effects from the DHT conversion, taking a little dutasteride should not harm your muscle gains according to the study. I will link down below. All right, so this was a lot of information about testosterone and our prostate. Always make sure to monitor your health, take blood tests regularly, make sure you're healthy. Please let me know what you think in the comments down below, and thank you for watching.